Good afternoon, and thank you so much for joining our Race Today podcast, where this is a 1 hour talk show about racism in the United States, as well as an activist platform to eradicate racism across the United States. I'm Dr. Alicia Williams and one of the co-producers for our Race Today podcast, and I'm going to hand it over to my co-producers to introduce themselves, and then we will introduce the panelists. And today's conversation will be focused on a conversation with Black breast cancer advocates and survivors. All right, Sherelle?
Hello, my name is Sherelle Zicki. I am one of the co-producers, and I'm looking forward to have this conversation with you ladies.
Thank you, Sherelle. Go ahead, Lisa.
Hi, my name is Lisa Tavalam. I'm also a co-producer, and I'm very excited to hear our panelists share their own experiences.
Thank you, Sherelle and Lisa. And now I'm going to begin with the introductions of our panelists. Up on my list first is Sharnae.
Hi, good morning, everyone. My name is Sharnae Lewis, and I am a blessed 13-year stage 3 breast cancer survivor.
Blessings, blessings.
Thank you, thank you.
And next we have Dr. Regina Hampton.
Hi, everyone. I'm Dr. Regina Hampton. I am a breast surgeon and breast oncologist. I am the chief of breast surgery at Luminous Health Doctors Community Medical Center, and I'm also the co-founder of Cherry Blossom Intimates.
Thank you. Nice to have you, Dr. Hampton, as well. Next, we have Tova.
Hi, my name is Tova Parker. I currently reside outside of Houston, Texas. I am a stage 3 invasive ductal carcinoma, triple negative breast cancer survivor. I am also a very active advocate, a strategic advisor for the Breast of Us organization that supports women of color impacted by breast cancer.
Thank you. Nice to have you, Tova. And last but not least, we have Tammy.
Hello, ladies and gentlemen. My name is Tammy Matthews. I am a nurse who supports all patients of all kinds, cancer survivors, Black, white, or other.
Thank you, Tammy. Nice to have you. And now I will hand it off officially to our moderator, CR. Nice to see you. Thank you for your time.
Nice to see you as well, Dr. Williams. Why don't we go ahead and get right into it? And again, I want to open this up to anyone that wants to answer the question. The first one is, what is your reason? Why did you study oncology and why breast cancer?
Well, I guess I can get started. So I'm a breast surgeon. And I am located just outside the Washington, D.C. area. And I think the field actually chose me. I didn't choose it. I, at the time, was one of the few female surgeons in my area, and I think there was one other Black female. And so people just started to send me the patients. And what I found is that some of the other providers just weren't giving good care to particularly Black and brown women. And they were leaving our county and going into Washington, D.C., where there's some great institutions. But I thought, when someone's going through their cancer journey, they should be able to stay close to home and know that they're going to get good care. And so that's what I set out to do and accomplish.
Thank you. Anyone else? All right. It's a thing that assumes a great deal of stature because it does affect so many people. And I'm wondering how did your families respond? And again, this is a question open to physicians as well as nurses also. What kind of help did your families provide in terms of you going through the difficulty of dealing with breast cancer? And Dr. Hampton, what have you seen in terms of the most helpful things that families can provide?
Yeah, I think that the journey, and we can certainly hear from the survivors, I think the journey is so different for each each woman and man that goes through this journey. What I find is that, we just have not spoken enough about breast cancer and all of the great strides we've made as far as treatment and treatment options, that many times patients, once they're diagnosed, they're kind of discouraged. They're kind of given old news about what used to happen 20, 30 years ago. And so I think we have to do a better job of just being more open, having more conversations like this, so that everyone knows, it's not a bad thing, and we have good outcomes every day after someone's diagnosed with breast cancer.
Thank you. Thank you. Anyone else?
Yes, I can speak on that. During my diagnosis, during my journey, but right after my diagnosis, I could say that, I have a very close-knit, broad family on both sides, paternal and maternal. And so for me, there was no shortage of help, whether it be physical support. I've had family members actually fly down and stay and, just being there to talk to. So for me, I think that my network and my village was really the foundation of how I was able to go through my journey. And I know that all women don't experience the same. But for me, my family was really critical for me being able to go through.
Thank you. Sister Charnay, I know you're bursting with impatience, wanting to get right into this. So what are your feelings about what you've heard so far?
So far, I just want to piggyback off of Tova. That's so true, because again, stage 3 breast cancer survivor, inductal carcinoma as well. And when I was first diagnosed, it came as a shock. And you struggle with the uncertainty of, I never questioned why. I just went in and just had the conversation with my mom. It's just like, okay, whatever it is, whatever, and how we need to allow me to get through this to become a survivor, I'm willing to face it head on. So I can say my mom, I get emotional every time I talk about it. My mom has been my biggest advocate, my biggest supporter. I was just blessed with an enormous and an abundance of family and friends, like friends of other friends who just stepped in and were just there, like just swarming to just do something. And that just means so much, because as a survivor, you need all the positive energy, affirmations that you can get, because whatever you feed the body will give you in return. So I just want to say that, yes, Tova, it is a blessing to have an enormous amount of family and friends who are there on both sides. Because on my mom and my dad's side, I had aunts who did not survive breast cancer, and a grandmother who was faced with it at the age of 18, and it came back at the age of 35. So she was my mentor to guide me through my entire process.
Thank you. Thank you very much.
Thank you.
Dr. Hampton, I'm sorry, I don't want to cut off anyone. Sister Tammy, did you have something you wanted to add?
Well, the only thing that unfortunately, I feel so inadequate in a certain space because a lot of my experience has been on the Urogyne side. Mm-hmm. So I've had patients do a complete annual exam and it's caught there, or they feel it themselves, come in for an exam and it's caught there. And on my end, I've just had to refer my patients out to the oncologist, because my doctor that I worked with was either the GYN or the Urogyne, and they just were not equipped. Now I'm from Memphis, so I didn't personally see a lot of Black oncologists. So I always wondered what that journey was for my patients, because unfortunately once, my role a lot of times was just sitting in the room, when they, get that diagnosis, or having to, call and say, well, this is what came back, or refer to a mammogram, and having them come back in to discuss the results and then refer out to oncology. So it can be humbling to just be in the room and to have to deliver, because a lot of times our patients think, oh, they hear cancer and they don't hear anything else. They hear cancer, I'm gonna die. So sitting there in the room and just be like, okay, wait a minute, I know you're tunnel right now, but don't come back to the light, because there is light. So again, I feel a little ill-equipped, but I'm always grateful and thankful to have the conversations, or even be in the room, just to be as a support.
Thank you. Thank you. Dr. Hampton, how has the field changed since you began practicing?
Oh, wow. It's changed greatly. We're doing less surgery. At one time we used to take out all the lymph nodes on everyone, and we don't take out as many lymph nodes because of the risk of lymphedema. And it was very debilitating to women probably 20, 30 years ago. So now, yes, we do still see lymphedema, but we don't see it as often. For me as a surgeon, we just think about our surgeries differently. We do breast conservation or lumpectomy, but if you look at some of the old pictures online, I mean, the results were just awful. It was sort of half a breast, there were dents in everywhere. And now we really think about hiding the scar. We can do a cancer operation as a breast reduction. So even with doing mastectomy, which is removal of the whole breast, I could show you a picture of a woman who had a mastectomy and you wouldn't realize she had one, because we can save her skin, we can save the nipple, we can hide the scars, and then we have great plastic surgeons who can do the reconstruction. Even the chemotherapies have changed. There are newer medications. We figured out how to decrease the reactions and the side effects that people have. Most of my patients who get chemotherapy, they continue to work every day. They travel, they still take care of their kids. And at one time, it used to be very debilitating to get chemotherapy. And for radiation, we've shortened the course of radiation down to, in some cases, 3 weeks. And I think the biggest change is that it's really a personalized approach to care. So each woman's tumor and each woman is going to really speak to us as the treatment team. And we're going to design a treatment plan for her and her tumor, not a one size fits all where everybody gets the same treatment.
If I can make a comment on Dr.
Sure.
Hampton's comment, I mean, when she's speaking, I felt like she's talking about me, right? Even down to the shoulder picture of the breast, and you wouldn't even know that the person had the double mastectomy. But what I would also add, though, is the reason that I became such an active advocate is that my experience was what Dr. Hampton described. I got choices up front. Before I even got my plan for treatment, my doctors brought in access. This is all of the clinical trials that you are qualified for. Before me even knowing not knowing what a clinical trial is, but knowing what to do for research. Talk to me about my options. This is your choice. You can choose you can choose what's best for you. I'll tell you the information that you need to make your decision. And it was very proactive. And after having the discussion, I've never had breast cancer before. No one in my family's had breast cancer on either side. I did the genetic testing, no evidence of mutations or anything. So I didn't know what the journey should be like for someone that's diagnosed. So I'm thinking it's normal. Like, if you had to get breast cancer, like I felt like I was equipped based off of the interaction I had with my doctors, and none of them were African Americans. So after my journey, I just, started hearing stories from a lot of women, and I'm like, wait a minute, I shouldn't be a special person. This shouldn't be a privilege for me to have the experience. Everyone should have had the same experience that I've had. So while I do agree that when I compare and I do research to where we were decades ago, it's not consistent for everyone. And I'm sure, Dr. Hampton knows that as well.
Absolutely. Thanks. in terms of you have, would you say you have two communities of support? One is family and one is professional. And do they ever cross lines? Do they meet? Sister Tova, I'll start with you. And
Oh yeah, so I'd say that, when by choice, I am a oil and gas executive, and I work a lot with like construction workers in my previous, I'm in production now, but my previous role when I was diagnosed, I was in the field in project management. And those are down south, down Louisiana, in the backwoods, Texas boys. That's who I was leading on my project, a crew of 1,400 of them. And when I got diagnosed, because of my leadership style, I'm a relationship-based leader. So I don't care who you are, right? I'm going to address everybody the same way. I developed enough of a relationship that the amount of support that I received from those people that looked, behaved, act, thought, talked, nothing like me was just mind-blowing. And so I had that frame, but then I also had my family and I had my friends, and then the support from a lot of the medical, those in the medical industry. So whether it be my breast surgeon, who now I call my breast friend, like, I have we're good friends. Like I have my own code to her house. And, so those lines do get crossed after if a person is there to support you individually and not as like a cog in the machine, then you have no choice but for those lines to cross. And so that's what I found in my specific journey.
thank you. Anyone else?
In my journey, I just want to say it was a little bit the opposite. My medical team was very supportive and, with options. But when it came to me working as the only brown girl working in information technology, my team was not supportive. So it's like you're battling cancer and then you have to battle issues in the workforce. So that was my downfall.
A general question to you all is Black health and wellness different from non-Black health and wellness?
Of course. Yes.
Give me a little bit more to work with now that you got my appetite going. Don't leave us, please.
I mean, personally and professionally, of course. I think we've always known it. I think the light is shining a little bit brighter on it. Other people didn't know it. We've always known it. Mm-hmm. We've always known there's been a discrepancy that this patient, even especially when it comes to our pain, people do not believe that I don't want to say people, I would say some non-Black doctors, non-Black nurses do not believe that we feel pain to the extent that we do. Unfortunately, we don't like to complain when we're in pain. And I've had to constantly say to my patients, well, I ask the question and I definitely advocate for my patients. If I see a brown person, and I don't hate to say it, I'm just gonna say it. When I see a brown person, brown or Black, I pay extra attention. I ask the questions and I believe them. Are you in pain? No, but your face is saying otherwise. Your body is saying otherwise. I'm looking at you, but you don't want to complain because you've complained before and nobody believed you. So if you complain, they're not going to believe you and they're not going to do anything anyway. So are you hurting? Are you in pain? Okay, let me go get you something. Or I have to go to doctors. Well, she's really in pain. Well, she really is. So having to fight or advocate fiercely for my patients when they're in pain, it's frustrating to me because now I see it definitely in a greater scope. So it's important to have someone with you in the room when you're just too tired to fight, to have somebody say, no, they can't even sleep at night. No, their pain is at a 10. No, this amount of medicine isn't going to work. or no, this medicine doesn't work at all. Because a lot of times we're drug seekers. We're drug seeking. If you know, being accused of wanting this versus that. Hey, if you're in pain, it's written for you. I'm going to make sure you get it. Or, hey, if that's not working, doc, this is really not working for her. It's causing this. Can we switch to something else? So yeah, it's very much a discrepancy.
Thank you.
Yeah, I wholeheartedly agree with Tammy. I think, you know, a lot of providers, they just don't take the time to understand some of the cultural differences. You know, to me, it's always more than the cancer. It's about, you know, what's going on in her life. I always say, what are the other cancers in her life that we may have to deal with and cut out in some respect that can help her to get through the treatment process. And I think it's understanding that, you know, we don't have as many conversations about cancer. You know, many of us don't see the success in our communities like we see in other communities. And so that really affects how women will come in through the treatment process and the journey. And it's really taking the time to understand that and realizing sometimes it may just take a little extra time, extra conversation, extra caring to really get that woman to understand the why we need her to do this treatment, what's the purpose of the treatment, so then we can get her to the yes of yes, I'm on board and let's move forward so I can be a survivor.
That is so critical. When you talked before, you said the advances that we're making, we are allowing people to have choices, right? It's more personalized. And pain management is also personalized as well. I can remember with my plastic surgeon, we had a conversation long before, mind you, because I had a deep flap after the double mastectomy. And he asked me, how is your pain tolerance? And so I said, I don't know how to answer that question. And this is a younger white male. And so he went through a series of questions, this conversations, this over time, over months. Okay, what does it take for you to have to take a Tylenol? Like and I started thinking to myself, and he's like, well, if you get a headache, what do? I'm like, I'll probably take a nap if I can take a nap. He's like, so you don't go run for a pill. Like, so he's trying to learn who I am and my behaviors and my patterns. So what we came to after that, just after having discussions, was I told him, you know, I prefer to not have opioids because I've had a history of addiction in my family. And I said, no, I prefer, I've seen that. I'm not saying that that's what it leads to, but I just prefer not to have that. So he took all of that information, all of my input, and for my surgery, we came up with a plan. And he says, okay, well, we're going to do an enhanced recovery after surgery method for you. ERAS is what they call it. And that's a non-opioid approach. And what we will do with that is that we'll give you what you want starting off with. But if you find that you're in too much pain, then we can always give you something. But this is the approach. That's what we need. We need people to listen, to care, to ask questions. What is your preference? What do you want? And as a medical professional, I'm going to see fit that you're not in pain, but I'm going to start with what you want.
It rarely happens. That rarely happens. It's expected that, you know, patients are going to want the opioids, or, you know, and then it's automatic. Not everyone wants them. So, and that's understandable as well. So I totally get it, but it doesn't happen that often. And the other thing that we see is resources. You know, people who already are struggling financially with paying their rent, paying their lights, getting to a doctor's appointment just for an annual exam, who hadn't been seen in the office and who knows how long, and then they get hit with this. You know, their resources are somewhat different for them.
Oh, absolutely.
As money, or even insurance, or even good insurance,
or parking, or having to pay for a sandwich and the catering and the lunch. All of it matters. Right. All of it.
Right. So we're talking about pain management. She's thinking about, okay, how am I going to pay for this prescription? How am I going to get to this next appointment? Who's going to pay for this surgery? What if I can't work while I'm down? You know, I may get put out. You know, it's a lot of moving cogs compared to people who have better resources, have more money, have better insurance?
I think one thing that other providers don't do is they don't realize that it's a journey, and sometimes you have to leave the door open. And many times a patient may not agree. And sometimes I'll say to my patients, listen, today we're going to just agree to disagree. Let's come back in a couple days. Let's revisit the conversation. Or let me send you to get a second opinion so you can hear the information a different way from a different provider. And then let's regroup. And, I think it's just leaving the door open. I have a funny, and she's now, it's funny, but not funny. So I have a patient, we had diagnosed her with a recurrence. She committed to chemo. She did a little bit of chemo, then she stopped. She came back and did a little more chemo. I had her on the schedule for surgery. Then she came off the schedule, and she just had a lot of things going on with her life. Well, I finally did her surgery a few weeks ago. And she knew my door's open. And I'm here, I'm going to provide support for you. And most folks would have been like, well, she didn't do this. So, she can't come back to this office. And that's just not the way that you help build relationship and build trust. And it really is about building trust with patients and realizing, they may not always get it the first day. And that's okay. We have to be okay and realize, it's about the getting through the journey and not like, trying to tick off every box at every moment.
Mhm.
And I think for me, I found it amazing how many conversations that I have with patients after the doctor leaves the room. The stuff that they thought they understood, they're like, yes, And then as soon as they leave, what did she say? What does this mean? So for me, on the relationship building end, also, again, with my brown patients, I just sit and have I'm your sister, I'm your cousin, I'm your friend. So we're in this room and okay, tell me, so what do you think? What did you hear? What did you hear? What do you think? What are your questions? Or we just sit there and say nothing. Or it's like, I didn't understand a word the doctor just said to me. I said, well, okay, well, what are your questions? And then do I need to go back and get the doctor and maybe they can come back and re-explain? Because sometimes doctors run in, they say some stuff and they run back out. And the person's just left in a fog. And that's, it happens sometimes. But me, in my role, a lot of times I have been caught in positions where I'm having to reinterpret the information. Jesus, let's go on and cry it out. Let's sit here for a little. I'm in no rush. They'll wait. So yeah.
Absolutely. So Tammy, you made me think of something. So one of my friends, unfortunately, co-worker that became a friend, was diagnosed like a year after mine. So she had a different kind of breast cancer, but some of the things were similar. So I went with her to one of her earlier appointments after her diagnosis when they're starting to talk about treatment plans. And so just like you said, like, when people are going through it for the first time, they have no clue. They don't if they don't have any relationships, so they have no understanding what the doctor's saying. They're nodding their heads. And so she's sitting there, and it's funny because the doctor is saying things. And of course, I know exactly what he's talking about because I just went through it for like 18 months ago. That was my life. I'm the future of what she's going through, right? So I'm sitting there and they're talking about reconstruction and he's talking about expanders. And she's like looking, and I was like, and so she's like, well, why? I don't think I want expanders. I said, okay, it's the difference between your boob looking like a raisin or a grape. Which one do you want? Right. But the doctor can't explain it like that. So when you talk about translating, when somebody's sitting there going through, they need real deal. Tell me so I can understand. Not all these words that they don't understand. And then they're not going to, I'm not going to stop him because what if he stops talking? What if he doesn't tell me something that I need to know, even though I don't know in the base place? So after that same doctor, he pulled me to the side and he said, hey, what you did there, I can't say it like that. And I'm like, no, but you can. And he's like, but, we're not necessarily, I get what you're saying. We're not necessarily trained to do that. But what we're doing is, it was at MD Anderson. It was a technology advance. And I guess that's as much as I'm supposed to say about it. So that's how I got to be on the board with them. And it's basically a way to make like a Siri for oncology. And so, my journey and my experiences is really what pushes me to say, okay, what you had should not be special. everybody should have had that. Like my breast surgeon, my oncologist, they would sit there and answer every single question that I had. They knew I had 1,000 questions, and they got to the point where after the first appointment, I'm going to say it in plain language, because if not, this appointment just going to be double the time, because she's not leaving until she answers all the questions that she had. So, I mean, everyone should have that, Tammy. And so I really do appreciate you for being that translator, that person for those patients.
Because I get it. I get it on the professional side, the doctor side, they're just, having to tell the information and be professional and all that.
Yeah.
Also, I guess once you get that relationship with the provider, with the doctor, look, doc, just tell me, just say it.
Right.
So, one in the room.
I'm gonna not give those doctors an excuse, because I think you've gotta read the room. You gotta know and pick up who is my audience, who comes in through my doors, and figure out what works, what type of communication. You've got to figure that out, and I think that goes across all races, ethnicities. If you're in a population that has mostly Asians, well, you need to learn the Asian community so you can best communicate to that. So I think I'm going to challenge any doctors and providers that are listening. We got to do better. We have got to do better to serve communities, and realizing, yes, we were taught another way. And yes, I can go in and talk, a certain way, but I also can be like, yes, girl, well, this is what we gonna do.
Right.
And so I think doctors, we got a code switch.
That's right. You're absolutely correct. Because when I started my journey, my doctor was just like, my breast surgeon and, my hematologist oncologist was just like, you are on it. Like I would have my mom meet me at my doctor's appointment, and I had a binder with everything in it. When I say information, I was reading it back to him. No, this is what you spoke about. This is what my questions were. And these are the questions you did not answer. So I would like to address these so that I can continue to make the most valuable decision for my life and my treatments. So, and I still have those binders to this day. So when I mentor other women, and like we all said, as survivors, each patient is different. Everybody's journey is different from the next person. But whatever my journey was, I can only explain to you my journey. But with technology, it has advanced so significantly that what I went through 13 years ago, like Dr. Hampton said, it's much, much more modernized today. So I definitely appreciate that, because I wish I had all of what's now back then, but you have to be your own advocate first before anybody.
Well, what are some of the unique challenges that African-American women face with breast cancer? Either from an institutional side or from a medical side?
So I think we heard some of it today. I think, unfortunately, there are still some communities that don't have, breast cancer treatment centers and have multidisciplinary teams. There are still some communities that don't have even 3D mammography, so we can diagnose that at an earlier stage. There's some women that have to travel a far distance just to go and see a good provider. The not being seen and heard and really accommodated in many of these medical practices. And that's where I think as women of color, we've got to advocate, and I think sometimes there's some people who just maybe don't get it. And I think it's in some respects, we have to help them to get it, and maybe to say, hey, maybe not during your treatment, maybe at the end of the treatment, going back to that provider and giving feedback. I think either write a letter or send an email, and it can be done in a very thoughtful way so that people may say, hey, I didn't realize that was how I was communicating, or I didn't realize that this patient needed something different. So I think, we need to advocate. I think we need to, hold the medical community accountable so that they see us and that they hear us and that they treat us with the respect and the state-of-the-art treatment that we deserve.
Thank you.
I think we need also need to hold our own.
Uh-huh.
I said, I think we also need to hold our own selves accountable and our families accountable. because I don't know about you, but I don't know how many times I heard growing up, oh, Aunt such and such just had a little procedure, or she just got a little bit of sugar, or no, she had a whole breast cancer diagnosis. She did not have a little procedure. And so understanding that and being able to talk about that empowers you to seek information so that you can know what questions to ask, so you can know what conversations to have as you are preparing and advocating for yourself before a diagnosis. But if everything is hush hush and we don't talk about it within our families and in our communities, then it's always a surprise, and it's much harder to deal with it if you've not already had that discussion and that support internally.
That's right, Tova. You're absolutely correct on that.
Okay. Well, how do each of you give back to your community as far as educating on the importance of advocacy for breast cancer?
I've started giving back back in 2011. I started and became the owner and founder of the Crystal Clear Pink Ribbon Foundation, which I started it with my friends because my friends know I like to shop. So I started my first foundation. I did my first fundraiser and raised over $9,000, but I started it with my own money to give back to our brown women, as far as teaching them how to do head wraps and self-care and how to take in and do self-affirmation, positive affirmations to help energize us internally, because everything starts internally. So it's internally and then it exudes to come out externally. So I've continued to give back. I continue to be a mentor to other women who are going along the same journey that myself and Tova have traveled. And, you know, and if there are friends that know of somebody that's in need, I step in. My foundation is just myself and my family. We step in and do what we need to do, because if we don't help our brown women and men, who else will?
That's amazing.
Thank you.
Thank you for that. Thank you for that, Shauna.
Thank
I
you.
like to get your information as well, because my advocacy journey has crossed over a lot of different spaces. So when I was going through my journey earlier on after my diagnosis, I used my words a lot with pen and paper. So I did a lot of blogging. And so I had a blog, well, it's still active, Pretty Sick. And on there, I basically journaled every moment throughout my journey, because when I was diagnosed, especially with triple negative breast cancer, there was no hope on the internet. I didn't see any, all I saw was statistics, and statistics don't inspire.
That's right.
So I felt like, I will be that voice for that next Black or brown woman who wants to see, you go to the doctor, oh, well, if it starts to turn pink, well, my skin don't turn pink. Like, so what are you talking about? Right. And so that they can have photos, so they can see for real, this is what it looks like. Right. And this is what I'm feeling. And so I've done that as well. And that's reached a really, really broad audience, which is really good, because that's what I did. It wasn't for me, it was for other people.
Yes.
And so since then, and after sharing my journey and talking to a lot of other people, what I realized is that what you went through was probably, like Tammy said, that's not normal. That's not what happens all the time, right? And so I started off on a course to try to help other women. And so that's why I joined For the Breast of Us. And their focus is only women of color, and providing that education, community, and also teaching them how to be advocates for themselves. I also do a little bit with Tiger Lily. That's another organization that supports women of color. And then, like I said, I sit on a board at MD Anderson as a patient advocate. So I just try to see where my spirit is moved to help other people. And most of the times that I do, this is you guys got me on there on this camera. This is typically not my space. I'm usually behind the scenes. So I don't need to be in the limelight, but I like to be in the back in the strategic space, seeing what we can do to progress the movement for women of colors.
Yes. So definitely let's connect after this. I look forward to it.
Yeah, for sure.
In addition to doing my practice every day, I also am the co-founder of Breast Care for Washington, and we are a 3D mammography center located in Ward 8 in Washington, D.C. That part of Washington, D.C. has some of the highest mortality rates for the city and actually across the country. And so it was really important to put a 3D unit. And when I went to advocate and ask for that, that's what I asked for. And said, if you're going to give me a used unit, no, thank you, because these women deserve better. And then we also have a mobile mammography unit as well that goes around the DMV, the DC, Maryland, Virginia area. And then I found for my patients, my breast cancer patients, after surgery, particularly women who've had mastectomy, when they went to, if they didn't do reconstruction and they went to go get a prosthesis, they were being given pink prosthetics for brown skin. And that just irritated me to no end. And so I think after a few patients in, I just figured, how can I solve this problem? And so I co-founded Cherry Blossom Intimates, where, we keep brown prosthetics in stock. So, and if any fair skinned women come in, we are happy to order that for them. We don't discriminate. And then we also do custom color matched prosthetics because, they come in standard pink and brown. And even I say white women are not pink, they have different shading and different tones. And so we're able to custom color match a prosthetic to meet anyone's skin tone. And so it was really important for me that women had a place to go in their community again, where they could get these items and not feel shamed. Our body sizes go up to a 5X. So it's really about all shapes, sizes, and skin tones. And that was really something that was important to me in serving my community.
Is there a difference in terms of how you respond to patients, the traditional route versus a holistic route?
Yeah, so I'm always open to conversations about the holistic route. I like to, educate them about what that means. We certainly are welcoming if they want to bring in some holistic practices, acupuncture, Reiki, massage therapy. I'm very clear that, a lot of those things haven't been proven to cure cancer, even though there's a lot of misconceptions. But, I'm happy to have my patients bring those type of therapies in because I feel like that's what they need to help get them through. Acupuncture is great, especially for patients undergoing chemotherapy, and can help with nausea and vomiting. And so I try to be very open. I have unfortunately had patients who, been misled about certain types of this natural treatment is going to work. It's going to help. And I've really unfortunately seen some women come in with some bad cancers because they were really given bad information as opposed to a more collaborative approach, and explaining how we get to the treatments. The treatments, we didn't just pick them off a tree. They've gone through rigorous clinical trials, and God bless all the women who've come before us who've helped us to get to the answers, and to the women who are involved in clinical trials now who are going to get us to the next level and get even better treatments. So I think those are things that are important for patients to know and understand.
Thank you. Did anyone else want to comment on the use of the holistic approach in breast cancer treatment? Okay. We're almost done, but I do want to inquire about the importance, if you believe there is, in terms of diet. How does that rate in terms of either prevention or treatment? Is there a role for diet?
So we certainly all advocate, diet and exercise, trying to, eat the healthiest you can be. That changes daily as we find out new information. We certainly try and encourage women to exercise, 3 to 4 times a week, trying to eat, lean meats, eat leafy vegetables. When women are going through chemotherapy, we really let them know, this is not the time to go on this big fad diet. to try and lose weight, because you're going to need all that nutrition in order to get you through that journey. So there are nutritionists now, there are oncology nutritionists now who are at many centers that can work with patients so that we can ensure that we're not only treating them medically, but they're feeding their body with the nutrients that they need to get them through the journey.
Okay. Anyone else? Then in that case, the American Cancer Society recently published a study that seemed to indicate that breast cancer rates are 52% higher in Black men than in white men. Any comments, perspectives on different cancer rates, different treatment styles for men?
Yeah, so breast cancer in men accounts for about 1% of all the cancers that we see. You know, luckily men don't have as much breast tissue as women. So many times if there's an abnormality, it's usually going to be a little more obvious before we see it or feel it in a woman. And the treatments are exactly the same. So when a man has a lump, we'll send him to get a mammogram and an ultrasound. We'll do the same type of biopsy. Men can get lumpectomy or mastectomy. They can get the same types of chemotherapy, and they even can get hormonal therapy as well if their tumor is a hormonally active tumor. So we treat male breast cancer exactly the same. Yeah, unfortunately, when we talk about, you know, Black women, we do get breast cancer at younger ages. And so I think that's another place where, you know, providers are still not aware that when a young Black woman in her 30s comes in with a breast complaint, we really got to tune in and listen and make sure that we're dotting all the I's and crossing the T's to make sure that we've ruled out a breast cancer, because we can't just look at her and say, oh, you have no family history, that's just a cyst. No, we've got to take it further, and we've got to prove that that's just a cyst.
Dr. Hampton, I'm sorry,
go ahead.
I just wanted to, while Dr. Hampton was speaking, is there any way that our African-American men, how would they know that they have breast cancer, or what are the other signs that they should look out for? Because you don't really hear, you know, a lot of language or a lot of informative information, you know, informing our brown men, you know, about breast cancer.
Yeah, so a lump that seems different when compared to the other side. Men can get bloody nipple discharge as well. Any skin changes, if it looks like someone's kind of pulling your skin inward. Men can also present with enlarged lymph nodes. So if under the arm it feels a little full, or you feel a knot there that you don't feel on the other side, that definitely is something to get checked out. I think, you know, my advice to everybody is, you know, if it's something that you weren't born with and it just came up suddenly, then that's something that you should get checked out and get evaluated for.
Thank you.
Advocacy seems exhausting. Why do you all still do it? What drives you?
There is no other choice. And I think as Black woman, I can speak for myself. I've been advocating for myself since I was 5, probably, right? So this is just a different space that we're having to advocate in. It's interesting. Right before my diagnosis, I was at like a leadership training for work, and it was really focused on the person. So it wasn't focused on what we could bring to the office, but what you can bring to yourself as an individual. And the training was called Indelible Mark. So the purpose was to figure out what your lasting legacy is. Like, what do you get passion out of? What do you think your purpose is? And so when I was diagnosed, I went back at and looked at the document where I wrote my indelible mark, and mine was to be the voice for those that go unseen and unheard, to make sure that everyone has a chance to succeed. Now, when I wrote that, I was talking about mentoring as a Black or brown person in corporate America, in the oil and gas industry, and advocating in that space. but that applies wholesale to this as well, right? And so it's like, if not me, then whom, right? So for me, it's another one of those spaces where I don't have a choice, and my passion is to help other people get to that point where they've developed their voice and help them to speak for themselves while as they're developing their voices.
Okay.
I-
Anyone
I-
would like, go ahead.
I would like to agree with wholeheartedly. I think us as Black women, it's almost, that's just what we do. I hate to say it like that, but I mean, it's almost no matter who it is, what it is what we do. Is what we do, is what we've always done. Unfortunately, sometimes to the detriment of our own selves. We advocate for others. Our brothers, our sisters, grandma, grandpa, the little kid, like, hey, don't do that. We're always speaking up in some shape, form, or fashion. So it's almost like it's not exhausting because we've just been doing it. It can be kind of, tiresome in certain spaces, but it's just because we do it. Why not throw the whole oomph behind whatever you're passionate about and just do it, be unapologetic about it, and just do it, because that's just what we do.
Okay. My last question is, what's the most important thing you've learned from your journey as a breast cancer survivor or treater? What's the most important thing that you all have learned?
My
Child.
most important thing that I've learned from it is to think and proclaim survivor.
Now, what does that mean to you?
It means to me is that we keep pushing no matter what. That's what we're used to. We're used to pushing. We have to think stronger. We have to think wiser. We have to think beyond of where we are right now. Sometimes we can't just look at the picture in a small box. We have to see the picture in a bigger frame. Is that if we were allowed to live thus far and we've been faced with this journey, you have to continue the journey all the way through. It's just like taking a race. You start the race, you finish the race.
Indeed. Okay. Anyone else? Again, the question on the floor, what have you learned from the most important thing you've learned from your journey as a breast cancer survivor?
For me, what I was reminded, because I don't think it's one of those things where you thought you learned it and then you learned it again and you're going to learn it again till you really learn it. For me, it was that you can't control everything, but you can control your reaction to it. And so for me, everybody's journey is different and everybody's reaction to their journey is different, but I just chose to go through mine with light. Right. So like Sharnae said, I never questioned. My faith didn't allow me to. Never questioned why me? Because why not me? If a million other women have gotten it, why not me? But going through it, I just always looked at it as, okay, well, what am I supposed to get out of this? How am I supposed to use this to help myself and help other people? And so through that, I was just reminded, you cannot control what happens. You can influence sometimes, but what you can control is your reaction to it and what you take from it.
Thank you. Anyone else?
Yeah, I think what I've, out from the provider side is to learn to listen, to learn to be understanding and empathetic, to learn to be flexible. Because sometimes, patients just aren't where we need them to be, and sometimes being flexible. And I've had to talk some of my colleagues into, not to say unconventional treatment, but to say, hey, let's think about this differently. She's not ready to do the chemotherapy. Let's let her go ahead and take a hormone pill, and let's circle back, give her some time to settle in. So, and then I'm learning to, as I advocate for my patients, trying to learn about self-care. And really learning to put myself first and realize that's not being selfish, but that means self-love, not only to me, but also to my family.
Thank you. Thank you so much. Well, that's it for the Q&A. I'm going to turn all of you lovely people back over to Dr. Alicia Williams. Thank you, and may the Creator continue to bless and encourage and strengthen all of you in your holy work. Dr. Williams, take it away.
Yes. Thank you, thank you, thank you, thank you, CR. I am just grateful. I'm grateful for you for being here to moderate. And each of your stories have been fantastic. My mom's sister passed from breast cancer way back when. And I'm just grateful to hear all of the encouragement, the light, Tova, that you talk about has been beautiful. Sharnae, just your story, your passion, your heart. And then Tammy, being able to hear from you about just the kind of the caregiver experience in the room. And Dr. Hampton, just your passion, your innovation, your like, we're going to get it done, you know, in a way that's going to be helpful for that particular patient. I have just been overwhelmed and truly, truly blessed by this experience. So I thank you very much for being here. I'm going to hand it over to Sherelle to officially close us out, but you have my gratitude.
Yes, I'd echo Dr. Alicia Williams to the T. You ladies are amazing. Your stories are great. You know, the one thing I do want to close out on, when my mom was diagnosed in 2018, the one thing that she told me was, I don't want to talk to you because you'll cry, because she knows that I am the sensitive one. And the way that I approach it, because I am a literal child, hey, I won't ask you any questions about breast cancer. We can talk about surface level things. But then we revisit that conversation today, and she's like, you know, I didn't want you to ask me of how I'm doing, but you could have asked me about my experience. Talk about this. So, you know, I have no problem with her showing me her scars. I have no problem looking at her double mastectomy. I'd have no problem talking about those things now and understanding the word of support for a breast cancer survivor. It comes in different ways. So, Tova, you know, I'm just like you. I am a Michelle in a full of Destiny Child. I'm totally fine with being Michelle. So I have no problem being in the background, but being supportive is something that you have to learn on both ends. Accountability for Black women is just something we need to we have to be kind to ourselves. And I just really appreciate you guys giving us this opportunity to hear your stories, to see what you're giving back to the community. And I look forward to hearing about the story 10 years from now, because this is such an impactful thing. Again, it was really great having this conversation with you all. You can find all this information on our website, bracetoday.org. And again, we'll be posting this on our Facebook, YouTube, and again, providing you guys with all this. But thank you so much for this conversation. This is such an uplifting thing. You guys do great work, and I hope to connect with you guys very soon.
Thank you.
Thank you.
Good afternoon.
Thank you.
Have a good afternoon, everyone.
Thank
Take
you.
care.
Bye.
Bye-bye.
Bye.